I want to give people a little bit of background. If you don't know who Dr. Schoenfeld is, those of you who grew up in the Bay Area during the golden ages of the 60s, we were fortunate enough to be a part of. First of all, Gene has been on the radio a lot. And in fact, you were a radio pioneer because you were one of the first doctors who started taking calls and addressing issues that were kind of controversial at the time. Of course, you became one of the leading experts in the crop of diseases that came up through all these things that happened in the 60s. But people had a lot of questions at that time, and you were very frank about the way you dealt with that. Was KSAN your first radio station?
Well, actually, it started on the old KMPX and then on KSAN. And I'm told I was the first doctor to answer questions live about any medical issues on the radio. Wow. And well, you should get some kind of award for that, because I know you helped a lot of people, and you helped me even at the time, although my father was a physician, you knew my dad, to when you... Your dad was a great guy, and he was one of my mentors when I was an intern in Berkeley. Oh, that really a terrific guy.
I'm glad that you guys touched each other's lives, because I can't think of two more special people in the medicine field. And my dad, I know, although he's not here anymore, everywhere I go, I mean, he delivered half the town of Berkeley, and right. People didn't forget him. He wasn't easy to forget.
He helped teach me how to deliver babies too.
Really? Yeah.
So I also did radio shows on KFRC and I guess most recently on KITS, which is
so you knew Big Daddy Tom Donahue, who was one of the founders of the whole underground FM.
Yes, I did know Tom.
And Dusty Street, you knew Dusty, right? Yeah.
Yes, sure.
I was just in touch with Dusty recently. She's in Ohio now, Cleveland, And but going back even further, we're going to bring you up to date on what Gene is up to these days. But I want to remind the folks so we can put your name to their memories of what you did. You had quite a body of work back then and even before, but specifically with the Bay Area, your columns in the Berkeley Barb were very well known, very well read. That was great. And so you were known as Dr. Hippocrates, or the short form with Dr. Hip, Right. How did you come up with that?
Well, the newspaper column did start in the Berkeley Barb, and the name for it was the idea of the Barb's publisher, Max Scheer. It was, of course, it was during the time of the hippies, and so it was called Hippocrates, after the old Greek doctor.
Right.
And eventually some of the newspapers started calling it Dr. Hippocrates and then Dr. Hip. And I was in the Sunday Chronicle for a number of years, and the Chronicle was... column was syndicated nationally eventually.
Wow. Well, Dr. Hip became quite a well-known figure, and there were immediate medical needs that were happening. There were thousands of runaway kids flocking to the Bay Area in the summer of love and after. And the party that was the summer of love soon became kind of a nightmare, because when they started bringing out some of the harder drugs,
Right.
And so then we started seeing, besides the associated psychological and medical problems, we had crime, which was unknown to us. Love and peace and flowers, hippie beads, the first crop of hippies. We didn't know crime. Everybody was so trusting of each other, and that was the magic of that time. I mean, I remember that, Gene. I was a part of that, and it was a beautiful time. I'm really very lucky that I was there during all that. But I also saw it turn into kind of a nightmare, and it happened pretty quickly too.
I was going to say that the era of the summer of love, it was all too short. And yes, it was the introduction of drugs like heroin and methamphetamine that caused a lot of crime and many casualties amongst the users of that time. And that's why people would ask me questions about the effects of drugs and sexuality, and I guess that's why people were so interested in my column, because at that time there were no newspaper columns that were dealing with questions of sexuality or drugs at that time.
And there was a lot of free sex was going on. There was actually a sexual freedom movement, you know, and so we didn't have AIDS back then, obviously.
No, it was, people used to say it was the golden age because it was after the introduction of birth control pills, but before AIDS.
Right. Yeah. So there was really a time of a lot of things developing, and there was a learning time for all of us. But it was really great to have you there. You were a great presence on the scene, and you were one of the founding people from the Haight-Ashbury Free Clinic, and that's still going on today, right?
It's still going on, and I did help publicize it through my newspaper columns, and at various times I volunteered there. I was also one of the first doctors with the rock medicine section of their clinic, which does a lot of good work now at events like rock concerts.
Wow. Well, that's great. So before you came out to the Bay Area, I want to call attention to the fact that you worked directly with the great Dr. Albert Schweitzer in Lambarena with the lepers, you know, and that was how, when I first met you. I got to see that wonderful slideshow when you came directly from Lambarena with Dr. Schweitzer's daughter.
Yes, I was lucky. First, as a medical student, I was there for a couple of weeks, and then I got a fellowship to return the following summer. And then a few years after that, I spent 6 months there based at the Schweitzer Hospital. So I was very fortunate to be able to work with Dr. Schweitzer when he was alive, and I'm still in contact with his daughter, Raina, who now lives in Pacific Palisades.
Wow.
She'll be 90 years old next January.
Oh, wow, that's beautiful. Well, give her my very best regards from myself and my family.
I will.
We enjoyed so much meeting her, and those slides and your talk had a profound effect on me at that time, and I was just, you know, in awe of the work that you were doing with the lepers. First of all, you know, folks, a lot of people would be afraid to go and be in the presence of people with leprosy, you know, because nobody wants to catch it. It is obviously was contagious. So how was it that Dr. Schweitzer figured out that he could go in amongst a leper colony and come out unscathed by the disease in the first place?
Well, he learned that it takes many years of intimate contact with lepers in order to get the disease. So that if you're just treating, you know, the lepers, and you take precautions, you know, washing hands, things like that, and you don't actually live in close quarters, you know, with the patients who have leprosy, then you're not likely to get it. It is possible, but unlikely. By the time I was there, drugs had been developed to stop the progression of leprosy, so I didn't have those extreme fears. I had a little uneasiness, but it was one of my jobs there to go each afternoon to the leper village and help dress the wounds of the lepers. Well, thanks, John.
Yeah.
I'd like to tell your listeners that you should listen to John's program and keep listening to KYOU.
All right, you're the best. Thanks a lot. Dr. Eugene Schoenfeld on the HammondCast show, KYOU, San Francisco, California.